Yesterday, the premiers and I had another productive meeting. We talked about vaccines, testing, and what we can do to beat this third wave. We also talked at length about borders. Premier Ford asked that we suspend the arrival of international students. Because at this time, Ontario is the only province requesting this, we're happy to work more narrowly with them. We'll be reaching out to their officials today to formalize that request. Again, I want to be clear. This is not the time to travel. On land borders, as a reminder, anyone who comes to the U.S. land border has already been tested in the U.S. in the last 3 days. Then they have to get tested again. And everyone has to quarantine for 2 weeks and do another test on day 8. We're enforcing very severe consequences for anyone breaking these rules. Yesterday, in addition to all this, Deputy Prime Minister Freeland provided an update on the budget as well. I also took the opportunity to congratulate Premier Silver of Yukon on his re-election. I look forward to continuing to work with him on everything from the fight against climate change and creating affordable childcare to our commitment on building a stronger relationship with Indigenous peoples. In fact, I'll be calling Sandy later today so we can discuss these priorities further. As I told everyone around the table last night, it's vital that we keep working together. We're following the situation with this third wave closely, especially in places that are hardest hit. Yesterday, Alberta reported their highest single-day total since the beginning of the pandemic. Premier Kenney announced new restrictions to slow the spread of the virus, and our government is ready to work with the province to provide support. For Ontario, medical teams from the Canadian Armed Forces began arriving in Toronto on Tuesday night, including critical care nurses who will work in the ICUs. This first deployment of 55 members of the forces will be providing assistance to Sunnybrook Hospital and its mobile units. On Tuesday as well, a healthcare team from Newfoundland and Labrador arrived in Ontario. They're helping at Toronto General Hospital. Like I said before, we are actively working with the Government of Ontario to determine how else we can support them. For Nova Scotia, where cases are also high, we've deployed 60 Canadian Armed Forces members to testing centres to help stop the spread of the virus. And for New Brunswick, we've approved the province's request for assistance for long-term care homes. The Red Cross will assist in up to 3 facilities until the end of June. Nunavut has also requested additional support to deal with their current outbreaks. We're moving quickly to keep people safe by sending more PPE and health equipment and by providing support for households in isolation who need food or mental health services. We're also engaging with other provinces that are hit hard by this third wave to see how we can help. We're ready to send any resources needed to protect you and your family. And of course, we're continuing to deliver PPE, rapid tests, and vaccines. So far, we've distributed more than 15 million doses of vaccines right across the country. Wednesday, almost 1 million doses arrived in Canada, including our first shipment of the single-dose Janssen vaccine. Starting next week, we will be receiving 2 million doses a week just from Pfizer alone. This will mark another major ramp-up. We will continue to work with provinces and territories to get these doses to Canadians as quickly as possible.